So this is a patient, a 40-year-old woman I'm doing smart lipo on. I've already, of course, seen her in consult in the office, and now she's come back for the procedure. I've taken pictures of her standing up, and I've marked the areas we're doing. So as you can see in her abdomen, we're doing her lower abdomen, her upper abdomen. I've made a tiny little incision down here, and then the next incision's here. And what I've done is I've placed the catheter underneath the skin, and every time I step on the pedal, I'm infiltrating local anesthetic, and I'll essentially infiltrate this whole area. If you follow the IV tubing, we have an IV bag that's filled with local anesthetic, and every time I step on the pedal, I'll be infiltrating. She's actually wide awake, so go ahead and say hello to the audience, even though they can't see your face.
Hello.
There you go. So she's comfortable. Yeah, as she said, she's wide awake. And what I'll do is I'll numb this area up. And I won't bore you by having you watch me infiltrate it, but I do it very slowly, very gently. And then the next step, which I'll be showing you shortly, is I'll take this catheter out and replace it with a laser fiber. By that point, to be completely numb, and every time I move the laser fiber around underneath the skin, I'll be melting fat. Now I've numbed up her abdomen completely. I've got the catheter in here, which is completely numbed up her abdomen. This is the fiber optic laser fiber. As you can see, it's connected to the cynosure equipment. And what I'm going to do is I slide it underneath, and you can see the guide light here. It's not actually a laser beam. This is just the light that's showing me where it goes. I slip it underneath the skin, and it just slides in very easily. And every time I step on the pedal, it'll fire. And as I'm doing it now, I'm not hurting you at all, am I? Can you feel anything? Right, and that's the way it should be. And again, if you notice, it's a very gentle motion. There's no thrashing and no pushing hard. It's very gentle. And I'll do this for several minutes. How much and how long, it really varies from person to person. I've done hundreds of these cases, so it's based on experience. Plus, the machine that I just showed you keeps track of how much energy I've delivered. So I have an idea of how much energy I want to deliver, but I also go a lot by feel. And this process will be repeated over the entire abdomen that I've numbed up. And then my third step, which we'll show you shortly, is I'll take this out and I'll suck out the fat that I've melted. So now I've done the smart lipo to her upper and lower abdomen. Notice the way her abdomen's white. That's from the epinephrine effect. This is the liposuction cannula, and it's quite small. It's got a blunt tip, so it's very safe, and it's got 3 little holes. And as you can see, I can just slip it under, and I'm moving it gently. There's no roughness. And what I'm doing is I'm sucking out the fat that I melted. And I'll do this for several minutes. Again, there shouldn't be any discomfort. She can feel me touching her, just like if I pushed on her shoe when she was wearing it. She knows I'm there, but it's not hurting her. And if you notice with the tubing, this is the melted fat that's coming out. And I'll do this for several minutes to all the areas after I've melted the fat with the laser.